Hey everybody, welcome to the Nightly Relay. I'm your host. I can hear a bus talking outside my window. We don't record in a professional studio here at the Nightly Relay. Just an old living room studio setup. Anyway, how's it going in your neck of the woods? Lots of stuff to report on. I want to talk about a few different things. One, last night we had Democratic primaries in 7 states, and Bernie Sanders did not do that well. It looks like he may come out of it with 2 states, North Dakota and possibly Washington State. But he lost in Michigan, he lost in Missouri, and a few other places. So that took a lot of air out of his campaign, but Bernie has come out today and said, I am not quitting. I'm in it to win it. And he marches on. So I want to talk a little bit about that. He still is in this thing. I mean, he picks up a few more big states like New York, Pennsylvania, Ohio. He could potentially pull this out. So we're not giving up on Bernie just yet, but also want to talk about the coronavirus, COVID-19. Today, the World Health Organization just declared, a lot of activity out on the streets out there. You can probably hear it. An ambulance just went by. They're dropping like flies, apparently. So the World Health Organization, WHO, declared COVID-19, the novel coronavirus, a pandemic, which means it has spread to all of the continents except for Antarctica. I don't think it's made it to Antarctica yet, but there's over 100,000 cases now, and many deaths. Here in the United States, we're over 1,000 cases. So let me just address some of the things that are bothering me about how the Trump administration has been handling this from the get-go. First of all, you have Donald Trump, who doesn't want anybody to worry, he doesn't want anybody to panic, he doesn't want the reaction in the stock market. Today, again, the stock market was down over 1,400 points, putting it into bear market territory, 20 points or 20 percentage points down from its high back on February 12th. So that happened today. So a lot of stuff, and I felt the need to actually have a nightly relay tonight. But first, you have Donald Trump, who has been very lackadaisical and also confused. He really doesn't. This is out of his league. It's out of his, what they say, his pay scale category or whatever, pay grade. He is not taking a leadership role. He has a very disorganized cabinet. The people that run the CDC seem to be they have no idea. They can't get anything accomplished here. They only now, and we're talking about well over 2 months into this thing, starting over in China, and at least a month since it's been here in the United States. You have a situation where the CDC originally couldn't get enough test kits out, would not authorize the use of test kits at facilities outside of public health facilities. So they're only just now starting to allow those things, tests at hospitals and private labs and things like that. And they only just made available something like 1 million test kits. Prior to this, we knew sometime only a week ago that there were only about between 5,000 and 6,000 people tested, and no clue as to how many people actually tested positive with those tests. The CDC still does not know for sure because they don't have a reporting system up and running. They said yesterday that, they've got an IT guy working on that. There is a reporting system they could use. It's called email. You just type in the number and send it over. There's all kinds of things they could be doing, but of course, totally mismanaged over there at the CDC and all throughout the Trump administration. He's got Mike Pence, who bungled and botched an HIV outbreak in his state, Indiana. He says things like, "We'll pray for you." That's who's running. It's good to know. The guy that's running the show is going to pray for us. Unfortunately, that's probably not going to help many of us or keep us from getting the coronavirus, COVID-19. So totally mismanaged. And now they're saying things. I heard a report on the radio here in my local area, a local health official saying, we recommend that businesses that don't offer paid sick leave to kind of, if you would, maybe it would be nice, maybe please, if you could offer that to your employees, because we don't want people not staying home, going to the workplace when they could potentially be sick with this virus. But they're afraid that if they miss work, they can't pay their bills. So that's point number one. And point number two, of course, our current healthcare system and our health insurance system, and the fact that we have millions and millions and millions of people who don't have healthcare, can't afford healthcare, or can barely afford the health insurance that they do have, and it doesn't cover everything. And out-of-pocket expenses like a prolonged stay in the hospital or an emergency room visit is going to cost you a lot of money. So now I want to bring that back to Bernie Sanders, because with Bernie Sanders, I know he's slipping right now, but if you're still wondering, could Bernie help us? Yeah, he could help us with a situation like this. Number one, Bernie has Medicare for all. Everybody's covered. Everybody gets the same health care. You're not denied. You don't have to worry about going bankrupt. And so if you get sick with something like the coronavirus, you're okay. Second, Bernie wants to protect workers' rights. He wants to raise the minimum wage. He wants to make sure that people have a good living, that are not out there humping around, going to work sick, just because they wouldn't be able to afford to pay their bills. That's ridiculous. Under Bernie Sanders, Bernie takes care of that. So this is the kind of situation that we're talking about. We've allowed ourselves to get to a point where they can't even, address an outbreak of a pandemic here in the United States because they're afraid of what it will do to the economy. That shouldn't be a concern. In Japan, they had a few cases and they closed everything down. And that seemed to work very well. They actually prevented a huge outbreak there. In Italy, not the case. Italy now has thousands of cases and many, many deaths. And they had just now, this week, shut down the entire country. You can't move around now. And so they're going to pay for that inaction. And I believe that we're going to pay for our inaction as well. When those test kits finally get out there, and there's a couple of million people getting tested, I think you're going to see the numbers of coronavirus in this country go up. So that's pretty much all I had to add to this ridiculous situation we're in, and didn't have to be in if we actually had a real president running our country, running the government, and a real CDC and real public health officials and people that knew what they were doing and how to respond. He's floating ideas now. Payroll tax holiday. Maybe they'll delay the April 15th deadline to pay your taxes. Who knows? They're not quite sure. But this all should have been. They should have seen this coming at least a month ago, and should have had plans ready when we got to this point. It was needless to get to this point. But look who's your president. If Bernie Sanders were president, this would not be a problem for anybody. Our health Our health is a right. It's a human right. And the guy that says that and the guy that believes that is not going to let a situation like this occur. And so those are my thoughts. This is the Nightly Relay. Tomorrow, Thursday, Thirsty Thursday, I'm going to try to do another beer review. Oh, you'll want to watch that. See you later.